Okay. Welcome, everyone. I can hear the echo. Okay.
Yes, Donna, you hear that double echo?
I could hear it. I muted my speaker here, so I think we should be okay now.
Okay, thanks, Donna. Welcome, everyone, to our meeting. I'll call the meeting to order. And let's see who's present. So then Donna can kind of take count of those who are present. So would you announce yourself if you are on the meeting?
Casey Newman.
Yeah, I know you.
Leslie Satterland. Hi, everyone.
Donna, I think we'll need the two members in the room with you. And we can't hear you, Donna, at the moment, so I will recognize.
We have Lydia and Julie are in the room with me.
There we go. Thank you.
Jason, Senator Roars, I just arrived, just to let you know.
Thank you.
Okay.
And Dr. Wiebe, I just want to let you know, legal counsel mentioned that they are on another phone call. They're running a little behind, but Allison will join shortly.
Okay, perfect. Thank you. Okay. So let's move to our first item, which is approval of the minutes. The minutes were disseminated in the communication previously, so I will entertain a motion for approval of the minutes.
So moved.
So I see, I believe Lydia is seconding. So all those who are in favor of approving the minutes, say aye.
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 Any
Aye.
opposed, same sign? Okay, thank you. Let's move to the second item, which is the vacant board position.
Dr. Wiebe and board members, good afternoon. We did want to make sure that the board was made aware of a current vacancy that has occurred. The board does consist of 9 members. 6 are appointed by the governor, and then we have 2 legislators, and then Dr. Wiebe as well, given his current position. The current vacancy is the representative of a dispensary. Jake Cassavan submitted his resignation as a board member near the end of August. So this position is shown as vacant on the governor's office website, and just wanted to make board members aware of that.
Has anyone applied for this? Does anyone know?
Leslie, that would be a question for the governor's office. I'm not aware of. We don't typically involve in that process as far as getting applications. They would be submitted. And I think, if I recall correctly, the governor's office has an online application for that now. Dr. Wiebe is shaking his head, so I actually know what I'm talking about here. So that's a good thing. So that would be more of a question for that office than us.
Sounds good. Thanks.
Okay, thank you, Jason. We'll move to the second item, which is the Department of Health and Human Services merger. And I think this is an item for me. It is just briefly for awareness that the Department of Health and the Department of Human Services have integrated and merged into the Department of Health and Human Services on September 1st. So we are 21 days into that integration as one agency, as one department. For the most part, almost 99.9% of staff members of our team are still doing the same job. They haven't seen much of changes. They are doing the same job. They are reporting to the same supervisor. They have the same responsibilities and providing services to our citizens. There are few that had seen some changes due to the integration of the two departments. My position is becoming more of a leadership visionary or a vision and strategy level for the whole Department of Health and Human Services, in addition to still serving as the state health officer for the state. The Division of Medical Marijuana is still under the Department of Public Health. So what used to be the Department of Health is now a Division of Public Health. And the Division of, or the, what do you call it, the section of medical marijuana is still within the Division of Public Health. So that's briefly what is the update on the integration of both departments, and I'm open for any additional questions or details if you have any.
Thanks for covering that,
Okay.
Dr. Wiebe. I would
Okay.
just mention too, board members, eventually we will be moving over to a new website and going through and updating all information, and we'll be doing that here at a future date.
Okay. So with that, maybe we'll move to administrative rules update, Jason.
Well, Dr. Wiebe, you did such a nice job on the last one. I thought maybe you would take this one for me too. This month, our proposed rules did go to the Legislative Administrative Rules Committee. The rule changes become effective on October 1st. So within a few days here, those are implemented. We did cover the rule changes with the board at the last meeting. And there have been no changes since that time, so I wasn't going to go over everything in relation to the rule changes since we didn't have any changes. I would point out to the board members one change that effective on October 1 relates to the application fee for the qualifying patients. On October 1, qualifying patients application fee is cut in half. It'll go from $50 to $25. So we are currently working on finalizing the programming changes within the application system itself, also working with the vendor to make sure that we can process the electronic payments right away on October 1. And then we'll be updating our website materials as well to reflect that change.
Okay, any questions for Jason about this process?
No, we knew it was going to be kind of long and incremental.
Okay. So maybe we'll move then to the 30-day allotment item.
Last but certainly not least, Dr. Wiebe and board members, is to pick up on our discussion from the last board meeting. You may recall we did discuss the 30-day allotment, and specifically that 4,000 milligrams of THC and the allotment and how that works, provided some information from other states. Keep in mind that 4,000 milligrams of THC relates to then the concentrates, solutions, capsules, patches, and the lotions. There was discussion regarding that the 4,000 milligrams possibly needed to be raised based on information that we'd been hearing from certain patients, as well as the dispensary personnel and people who work directly at the dispensaries. We did state at the last meeting that we'd bring this back to the board to continue the discussion and to see whether or not the board would like to consider suggesting or recommending a specific amount to move forward, and then what steps possibly to take in regards to legislation. And we would certainly then take that into consideration on our end.
I guess I would like to move to raise that limit to 8,000 milligrams. I do believe it's just, and hopefully Senator Roars will help us out with this. Sorry.
Okay. You get me and Matt Ruby on board and you got a pretty good team, so.
I'll certainly work on that, and I'd appreciate your help, but I do think, we may be curtailed back, right, to 6. 8, I think would be beneficial for the patients, excuse me. But if it did get curtailed back to 6, I think it certainly would be a good start. Hopefully that makes sense.
Mm-hmm. I'll second that motion.
Oh, Dr. Reedy, I think still on mute there.
Yep, thank you. My apologies. So it's been moved and seconded to increase the level to 8 grams or milligrams.
Yep, to milligrams. Dr. Weedy, I'm going to interject here, and unfortunately, Allison's not here. This would be a legal question in regards to the board, since it is an advisory board. If you need a specific motion passed in regards to that, or if it's the board agreed that they wanted to see the milligrams go from 4,000 to 8,000 with this implementation plan.
Sure.
So I'm not specifically sure which direction you would like to go. It may be safer to say to pass the motion, and if Allison says that motion really doesn't have any basis, the intent is still there to me. That can be put into minutes that the board wanted to advise the department to do this.
Okay. So do we have an idea when Allison could be joining the call? So then that might give us an answer to the situation.
I will see. I'll see if she responds back here. But in the meantime, I think if I heard correctly, looking at, and I don't mean to put words in either individual's mouths here with Casey and Senator Roars, but looking at wanting to recommend, and there's Allison. So Dr. Weeby, I can certainly give her a synopsis.
What
Yes,
did
please.
Jason break already? It's been 15 minutes. What did you do, Jason?
He didn't do anything. We got ahead of him.
So I stalled and babbled just long enough, Allison, for you to get on. So the agenda item relating to the 30-day allotment, they had made a motion and was seconded to increase it to 8,000 and to, I think, have Senator Roars work on legislation, possibly with other legislators, to get the bill introduced. I mentioned advisory board, so I wasn't sure if a motion was specifically needed or warranted for that.
Yes, because someone needs to record in the minutes that it was actually the wishes of the board that you want Senator Roars to pursue this.
Very good.
Okay. So it's been moved and seconded to increase the level to 8,000 milligrams. All those who are in favor, say aye.
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 Opposed, same sign.
I am going to be the wet blanket here and say you need to do a roll call.
Sure. Okay.
Which this kind of was a roll call, but.
Okay, so maybe Donna, will you help us with a roll call?
Yes, I can do that. Casey Newman,
Here.
Julie Wagendorf.
I think you would just say yes or no.
Yes.
Yes.
Yeah,
Casey,
instead of a
yes.
roll call, Donna's gonna take a motion, so a yay, nay, yes, or nay would be sufficient for him.
Okay, Casey Newman,
Casey,
Julie
you
Wagon.
said here instead of yes, so she just needs the verbalization.
Yes.
Julie. Leslie Settleman,
Yes.
Kristen Roars,
Yes.
Nazar Weeby,
Yes.
Jason, do I go through all of us?
No,
Only
No.
voting members, right?
only
Okay.
voting members.
And you have 6 members currently online and in the room.
Yep, I have 6 yeses.
Okay, motion passed.
On behalf of the program, Senator Roars, thank you for taking that up. And if there's anything you need from the division, please feel free to reach out.
Sounds good.
Okay. So let's see about the next board meeting.
Yeah, Dr. Wiebe and board members, you've been looking at kind of quarterly meetings, roughly give or take, a timeline in there for everything. So if you would like, we could certainly, again, like we have been in the past, find a couple of dates. With the end of the calendar year coming up here, we'd probably suggest possibly looking early December. If that would be okay with board members, and then, get an agenda. And as always, board members, when you get the notice of, this is the date, you're more than welcome to provide to us an agenda item that you would like to have, and we can take that into consideration and look at getting it added to the agenda as well.
I would prefer it's not on the 6th and 7th. We have that's the legislative organizational session.
Do you know, Senator Roars, as far as I believe Representative Westland's through the calendar year, is that correct?
But I thought he resigned even though it went through the calendar year.
He rescinded his resignation and was still a board member.
It would be through December 1st, actually.
Okay,
That's when his term ends.
so if board members are okay, we could certainly send out a poll for maybe later on in that first week of December, early the second week of December, before things get really crazy with end of the year festivities and travel plans and other work.
Sounds good.
I think I saw a lot of head nods and thumbs up, Dr. Wiebe, so we will go with that plan.
Sure.
Are we all done? Was that really our whole agenda?
Senator Royers, this was one of those where the online seemed to be a good way to go with a shorter agenda item. Board members should be aware that the next meeting may be significantly longer.
Sounds good. Casey must have gotten kicked out.
Yeah, there he's back.
You couldn't make it up. The internet went down in the whole office for a whopping 2 minutes.
Funny.
I apologize.
No issues. Okay, and any
Finish our
last?
business. We're about to adjourn.
Perfect. Just kidding.
Any last questions or thoughts? Okay, hearing none, then I think we stand adjourned. Thank you,
Thank you,
Jason,
everyone.
and thanks everyone.
Thank you.
Mhm.
Thanks, everybody. Sorry for
Thank
the
you.
hassle.
Bye-bye.
Apologize.